Thank you, everyone, and welcome to our partnership session for today's program. I'm Karilyn Van Oosten, the Vice President of Strategic Business Development for Unitek Learning. You will now hear from two amazing colleagues who will share with you examples of how strategic partnering has proven to be a worthwhile venture. During the presentation, if you have any questions, please enter them into the chat feature, and we will share those with the presenters at the end. First, you will hear from Jeannee Parker Martin. Jeannee is the president and CEO of LeadingAge California and vice chairman of the Corridor Group Holdings. She is nationally and internationally recognized as a leader in healthcare service delivery development, and she is sought out by boards and executives teams for leadership and understanding and strategic financial and governance matters and the impact of Affordable Care Act. You will also hear from Ray Soriano. Ray has been with Kaiser Permanente for over 24 years, serving as the Regional Director of Professional Development and Education in Northern California. He works with regional and local leaders to design educational initiatives and developmental programs for residency to leadership roles. He also leads the development of onboarding and educational programs for frontline staff and leaders in resource management. I will now turn it over to Jeannee.
Thank you, Karilyn. I'm honored to be here to share information about partnerships. And you know, it's very interesting. As Dr. Joseph said in his opening remarks this morning, partnerships are critical to the success of creating career pathways to close workforce gaps. And I think it is critical that we create partnerships. In my career, as a nurse and as a nurse leader, perhaps the most important aspect has been partnering in collaboration with academia, with departments of health, with federal agencies, with churches, with high schools and mentors and colleagues. From the time I was in college, I crossed the schools of languages and linguistics where I started, with the School of Nursing where I ended at Georgetown University, so that translation services would be available to patients across their health services. In graduate school, I partnered with the local Department of Health and the local Visiting Nurse Association to tackle the rising issue of AIDS at that time in the early 80s, when the disease trajectory was not well understood, and we all had to work together and team up to understand this important issue. And for the past 30 years, I've sought thought leaders to partner together and challenge our thinking, assuring that we were not lemmings, but rather creating something better. And today, I'm very proud to have served on the Governor's Master Plan for Aging Stakeholder Advisory Committee in California and the Federal Coronavirus Commission on Safety and Quality in Nursing Homes. These two committees broaden my understanding of not only California's needs, but also the nation's need for more workforce in healthcare, and particularly in the field of nursing. Whenever I start a presentation, regardless of the content, I think it's really important to understand your own vision and your own mission. And I think that's critical in partnerships as well. When we understand our vision, we can also understand how partnerships can accelerate the mission of your organization. LeadingAge California is a trade association that focuses primarily on nonprofit providers of housing, care, and services for older adults in California. With over 700 members, we're now celebrating our 60th anniversary this year. You can follow us on YouTube actually and see some of our great videos. Our members include life plan communities, also known as continuing care retirement communities, assisted living communities, skilled nursing facilities, senior affordable housing, home health, hospice, and other home and community-based service providers like PACE. Our mission is to advance housing, care, and services in California so that older adults in California will have the housing, care, and services that they need as they age. And here's some information about those statistics. 1 in 5 Californians will be over 65 by 2030, many requiring caregiving assistance. And as all of us know, home health and hospice is becoming a more desirable as well as more sought after field and care delivery site, particularly as health plans and Medicare and Medicaid have become more engaged in how beneficial home and community-based services are. Since we can't do it alone, we have partnered with Unitek Learning to help build a career ladder to encourage students to progress from high school to CNA, LVN, and RN level positions. With Unitek's progressive approach to education, LeadingAge California's membership and understanding of education needs, we will partner together and collaborate with others to build the workforce in California in particular. So let me back up just a little bit and talk about our partnerships that are helping to grow the workforce in California. I mentioned the Master Plan for Aging, which in 2019, Governor Gavin Newsom issued an executive order calling for the creation of a master plan for aging. The executive order affirmed the priority of the health and well-being of older adults and the need for policies that promote healthy aging. It also called for a blueprint for state government, local government, the private sector, and philanthropy to partner together to prepare the state for the coming demographic challenges and continue California's leadership in aging, disability, and equity. In mid-2019, as I mentioned, I was fortunate to be appointed, along with 23 other colleagues, to the Governor's Master Plan for Aging Stakeholder Advisory Committee. This important committee was tasked with advising on the creation of that roadmap for the path forward between 2020 and 2030. The final report was made public in January of 2021. And COVID-19 underscored some of the systemic disparities that we have across the state in housing, care, and services, as well as disparities by race, ethnicity, economics, and geography. The master plan was a diligent effort and thoughtful effort informed by data and information, experts in myriad areas for older adults, including consumers, caregivers, providers, government officials, academic partners, and others. And that whole group of individuals have remained engaged in conversations and partnership to collaborate so that there is success. The Master Plan for Aging outlines 5 bold goals and 23 strategies to build a California for all ages by 2030. It also includes a data dashboard on aging to measure our progress and a local playbook to drive partnerships that help us meet these goals together. And I hope you'll each go to the Master Plan for Aging website to learn more about these 5 bold goals. I'm just going to hone in on one for this conversation, and that is goal number 4. Caregiving that works. We will be prepared for and supported through the rewards and challenges of caring for aging loved ones. And as has been mentioned on the panel just previously, the spectrum of caregiving across aging starts at birth. It doesn't start as we age, as we hit 60 or 65. It starts at birth. So there's a huge opportunity to create workforce opportunities in healthcare across that aging spectrum. The target for this particular goal is 1 million high-quality caregiving jobs. And I just want to talk about a couple of those initiatives which are outlined in further detail on the website. Initiative 111 is to create and convene a direct care workforce solutions table. This is an opportunity, again, to partner so that across the table, there are many different viewpoints. Initiative 112 is to consider expanding online training platforms like we're discussing with Unitek Learning and our own online learning center. And initiative number 3, to diversify the pipeline for direct care workers in home and community-based settings by testing and scaling emerging models such as healthcare career pathways, high road direct care, universal home care workers, and more to meet the need as funding allows. So those are just a few highlights of the Master Plan for Aging. Additionally, LeadingAge California decided at the same time, essentially LeadingAge California, my organization, we were also working on workforce issues, and we're working on a workforce blueprint for action. We convened our workforce situation room for 3 years to create a blueprint for action that will guide us over the next 10. from 2021 to 2031. And you're getting a glimpse of what this work, what our blueprint looks like. This the workforce situation room, which was about 35 people who came together twice a year, was a demonstration of partnership with other leaders in education and training, academia, students from colleges and universities, our member provider organizations, tech companies, and other innovators and entrepreneurs to help us think through what the workforce needs are and will be over the next decade and how we could help grow the workforce for our membership and beyond. Information was also yielded from the Master Plan for Aging, as I just mentioned, as there is intersectionality in the creation of jobs, career advancement, and training elements between the two bodies of work. Our goal was based on the problem that there is caregiver demand and that retirees are continuing to grow and leave the workforce. In fact, we're expecting about 70% of the workforce of retirees will occur in the next 10 years. The outcome of this work, the Workforce Situation Room, resulted in 6 key strategies, 1 unifying goal to grow the workforce, and we pinpointed 16,000 new workers over the 10-year period for our member organizations, but as we partner with others, we know that that number will grow. And then we also have specific strategic actions for each year in that next 10-year period, again, in combination with partners. Before we move on to Rayne's presentation, I just want to emphasize the importance of partnerships and also understanding who we're serving. I have 2 very short clips. They're just 1 minute from our 60th anniversary 60/60 tour that I want to show you. So enjoy hearing some of the members that some of the residents that you as nurses and other healthcare professionals might be caring for in the future, but also as you understand and can feel compassion and understanding of what some of their needs are. So tell us a little bit about yourself, Rayne.
I was one school teacher and a probation counselor. I'm a workaholic. I worked 10 jobs. 2 jobs for 10 years. So I kind of pushed the button, and after that, I kind of got off. At the hospital, I guess I became a regular customer there, although it didn't seem like it to me. And a social worker, I was talking to a social worker, and she asked me a question about homelessness, which I was, and I answered yes. That's why my pride, I said yes. Because I was trying to get some bus fare to go to a home that wasn't there.
What brings you joy?
Every day when I get up and they're not throwing dirt on me, and I fail the world, taught this universe, God, and I'm in my right mind, and then I get my blank piece of paper out and I start writing. That's
Great. Well, gosh, we want to welcome Rosewood Court to the good community to our 60/60 tour. We're so excited. This is our 60th anniversary at LeadingAge, California. So Alice, welcome to you and to your residents and to your community. Maybe you could tell us a little bit about Rosewood Court.
Rosewood Court is one of the communities with human good. We manage the building under a project called Crack 202, which is basically a supportive system for elderly with low income.
Hi, Hermedia.
Hi, ma'am. Good morning. I just started that when I was in elementary. I played the piano through memory and theory. I don't read notes. I did not study piano. That's
So how old were you when you first played the piano?
grade 5. And when I got married at the age of 21, I had no more piano already because our work was to attend to the children, go to school, work. So no more piano for 50 years. When I came to California, I revived my music. Because in the adult daycare center, there is a piano there. So before our session, I used to practice. Sometimes in my neighbor's house, there is a piano. I play. Whenever I can see piano, it hurts me because I was not able to play anymore when I got married. Life was so hard. I have
So that gives you a glimpse and helps you understand a little bit about some of the individuals that are so important to our nursing career and also in home health and hospice settings. And partnership is the only way that we can create a better environment for all of them. So we're so excited about our partnership with Unitek Learning. LeadingAge California will partner with Unitek Learning to accelerate a career pathway and also to accelerate expansion of workers in home and community-based services in the state of California as we move forward. So with that, I'm going to turn this over to Rayne, and we'll take your questions after Rayne is done. Thank you.
Thank you so much, Jeannee, and hello, everyone. And again, thank you so much for being here on a beautiful Friday. And so, what I really want to share in the spirit of, the topic of partnership is the great work that we've done with, wonderful organizations and institutions like Unitek. And so what I'm going to share actually is not a slide deck, but our Nurse Scholars Academy website. And so here what you're seeing is the department or the area that I'm so passionate about and work in, and truly as Kaiser Permanente, as I mentioned earlier, it's a nationwide organization, but in Northern California I have the honor of caring for and supporting and developing the 24,000 plus nurses in our system. And so happy to announce that, this May, we're kicking off our first regional Northern California nurse residency program, where we'll be admitting 100 nurse residents who've just received their nursing licenses and graduated from nursing schools, such as yours, and, running that program twice a year. So every year we'll be bringing in 200 new licensed nurses to our organization in Northern California, and we have the honor of working and partnering with Unitek on those ventures. And just to touch base on, as you know, with the pandemic, one of the things that, as you've experienced as a partner organization, is the difficult choice that we had to make to pause clinical rotations, really making that hard decision, knowing that, clinical rotations are the key to, graduation and completing the programs. Yet, it was a dilemma because of as we mentioned, the PPE, the safety of our staff, the burnout, of students and staff, and at the same time, preparing you to come into the workforce, prepared to take care of patients with COVID or potentially with COVID, and so just really balancing a lot of those things. But back to the Scholars Academy, or Nurse Scholars Academy, as you can see, it's a program that I'm proud to be a part of, where we really develop nurses from new grads all the way to nurse leaders, educators, and staff. And we have programs, as Kaiser, like many of our hospitals, are unionized workforce, and so we work with a lot of our unions, including the California Nurses Association for our nurses. And so we have programs for employees who are represented under those unions, leaders who are not represented by those unions, and programs in the community. So as I go and show you this exciting new venture in our community programs, not only do we have academic partners such as Unitek, but we're also a very big believer in caring science. So caring science is the philosophy of our nurses and the theory at which our Northern California nurses work. And so glad to know that Unitek also is a part of that Caritas consortium. of leaders and educators. And so, preparing you to enter organizations such as ours, knowing that caring science is a strong part of our partnership with our patients and our communities. And so when I click on academic partners, we also do youth career days with all of our communities in terms of, schools, both high schools and schools who are technical schools who want to get into healthcare. And so, annually, except for last year and the pandemic, we do this youth career day where we sponsor, again, high schools, busloads of high school students to come into our facilities so that we could show them nursing programs, the different specialties, different careers within healthcare, that are meaningful to our community and to our organization. And so when I click on academic partners, what you'll see here is that, we've had long-standing partnerships with, schools like Samuel Merritt, my alma mater, the University of San Francisco. But, as Dr. Yosef and Karilyn and team just announced a couple months ago, I think now, we now have a solid and strong and ongoing partnership with your school, Unitek Learning. And so what this means is that not only will we be partnering with you more in terms of clinical rotations and exploring new programs, throughout the continuum, but also with our current staff nurses who are looking to go back to school and really sharing that, Unitek is one of the programs from caring science, from leadership development, from nursing programs and non-nursing healthcare programs that we want to partner with moving forward. And so I just wanted to share this exciting venture. And thank you again to Dr. Yosef and Karilyn for leading the way and being our partners there. And so just wanted to share a little bit more about, our programs that, I'm working on with our leaders and with our communities. And so for our nurses, what we want to do is once you become part of our organization is not have you feel stuck. We want to develop you in your role. And if you want to go from med-surg telemetry to the operating room, to the ICU, to the emergency department, to maternal child care, and to home health, hospice, and all of those settings, we have different pathways. And so if you want to become an educator or a manager or a CNE or a chief nurse, we have pathways for you. If you want to become nationally certified in any of the certifications, we've partnered with our national certification bodies like ANCC, AACN, with the magnet community in order to, become nationally certified in all of our ranks of nursing as well. Again, as I mentioned, if you're a nurse or a nurse leader interested in going back to school, we have those pathways built for you as well. And then lastly, just like today, let's say you want to present and present at a conference, whether it's a podium presentation or a poster presentation. We want to guide you and mentor you through that because public speaking and sharing knowledge and evidence-based practice is a standard that we want to aspire to for all of our nurses as well. So I just wanted to share that, these are various programs that we have, at Kaiser. And one of the things that I'm really excited to share is, as we talked about, a lot of the clinical care and the disparities that we see in our communities, one of the big ones is mental health, right, team, and behavioral health. You can't turn around and look at the shortage of, psychologists, social workers, psychiatrists, etc. So I'm really excited to share also that, along with the Nurse Scholars Academy, we've just launched our Mental Health Scholars Academy, where we're sponsoring and paying for up to 1,000, clinicians, students, who want to get into psychology, psych nurse practitioners, social workers, counselors, in order to help fill that gap in our communities, and partnering again with schools, such as Unitek and others to really develop, clinicians who want to get into that mental health and behavioral health space, knowing that that's such an important part of well-being and thriving, when it comes to aging in place as well. And so just really so excited to share our programs. We'll make sure that you have these links because these are outward facing links. And so you can learn more about, us. And although we started out in 1947, having our own School of Nursing, which we don't have anymore, we're so excited to partner with you at Unitek, in order to continue to develop programs that you can be excited about and look forward to once you graduate from your program of choice. And so thank you so much for your time today, and we'd be more than happy to answer any of your questions.
That was great, Rayne. I will just say that as you were talking, I was thinking about all the partnerships that we could have together. So it doesn't end. The learning just doesn't end.
More to come.
Yes. Thank you so much. And thank you so much, Jeannee, for those pearls of wisdom and all of that information that you were able to share. I do have a couple of questions that came in through our chat. And the first one is for you, Jeannee. It's how can you become a member of LeadingAge California?
Oh, well, that's a great question. I love that one. You can contact me. I think we can provide you can go to our website to find out our information. And then you can actually apply that way, or we can contact you directly. So if you go to our website, leadingageca.org, you can find out how to contact each of us.
Wonderful. Thank you so much. The next question, Rayne, is for you, is how do you find out about job opportunities at Kaiser Permanente?
Well, that's one of the things about being a large organization is, making sure our recruitment services and HR department keeps up with the demands. Because as you can imagine, with a lot of training programs and a lot of opportunities to advance and move across, different specialties, is trying to keep up and post positions, right? And it's not a click on and off, unfortunately. And so between going to jobs.kp.org in our main job site to look up, jobs all over the country. So if you want to live in Hawaii, we have Kaisers in Maui and Oahu that are looking for, skilled clinicians and leaders. If you want to live in the Northwest, Seattle is our new region. And so between Oregon and Seattle, and then the Mid-Atlantic states is another huge market, in Georgia, of course. So a lot of huge opportunities in different states all over California that are looking for skilled workforce across the continuum. And really, as Jeannee and our panel pointed out, our communities need you as far as skilled leaders and skilled clinicians in the workforce. So wherever you want to live, I'm pretty sure you will have a job for you. So.
That's fantastic.
I just want to comment on something Rayne said, because I think it's so critical to the listeners, especially the students, that a career path is not always a straight step ladder. Right. It can be a curvy road with V's in it, where you don't know, do you go to the right or to the left or Y's? So it can be a curvy path. And I think our speakers on the panel were great examples of that, who have, carried the bag in home health, so to speak, to becoming a CEO, to become corporate board members. I mean, really different opportunities as you grow. And it takes, I don't want to say it takes a village, but it takes partnerships. It takes mentors and colleagues to help you grow and thrive.
Yes, that's excellent, Jeannee. And that's one of the reasons why here at Unitek, we have everything from beginning stages, CNA or MA, all the way to master's, because there are so many opportunities and career paths with nursing and healthcare in general that are just endless. So it is, and it's growing. It's not getting any smaller. We have another question from the audience, and it's actually for you, Jeannee, and it's more about how was the workforce situation room developed? How did
that's a really great question. I do want to comment that I think posted in the chat, we put how to become a member of LeadingAge California. So yes, from the website, so you didn't have to search for it.
Thank you.
The workforce situation room was created as part of our strategic plan. We created our last strategic plan. Typically, we have a 3-year strategic plan. It was 2019 to 2021. And we had 5 initiatives. So as you create your own strategic plan, think small and big. You don't want to have too many things that you can't keep track of, that you want them to accelerate you to get somewhere else. So part of our strategic plan was to grow the workforce. And in the context of that initiative, we had action steps were to establish a workforce situation room. And that workforce situation room actually includes Gary Charlin and Linda Tanner. So we have both of those individuals in our workforce situation room. And we met over a 2-year period to help think through different issues. We had speakers who were leaders in workforce development and or knowledgeable in different areas of workforce development. And so that is how we traveled. And then in about 6 months ago, we started creating the actual plan. And in May, it will be presented formally to our board of directors. It hasn't even been presented yet.
So we're hearing it firsthand. That's fantastic.
You're hearing it first.
Wonderful. We do have a question, and it's actually from one of our professors here at Unitek. And their question is, how can we get our students currently involved with home health? What is the best path or avenue to do that?
So I can probably mention there are some internships and practicums in home health. That's probably the best way for students to get involved. And if you have a local home health agency, a VNA, there are only a few of those actually in California, but there are lots of home health providers in California, and also hospice providers and personal care providers like Charles Symes was talking about. So you could actually contact a local provider to establish a partnership for an internship program where they would go out and visit people in their homes, similar to the ones that you saw in the videos. And if you want to see more of those videos, including the ones that we showed here, you can see those on our YouTube station at LeadingAge California, on YouTube.
And Jeannee, also, I would be remiss if you did not have an opportunity to go ahead and mention your upcoming event.
Well, we have an annual conference on May 3rd to the 5th, coming up just in 2 weeks or less than 2 weeks now. It's a total virtual conference. We have special rates for students, and we also have a special post-conference rate to hear the keynotes. So it's all virtual. It's going to be very exciting because we're celebrating our 60th anniversary this year, and our 60/60 tour was part of that. And you also can go to our website to find out more information how to register for that conference. We'd love to have all of you attend. We have a very vibrant and very exciting conference planned.
Wonderful. And Rayne, one question for you is regarding partnerships. I know that we've established a fantastic partnership, but how does Kaiser go about partnering with other entities in the community and other schools in the community?
Yeah, no, that's a great question, Karilyn. And so one of the arms that we have as an organization, as you know, is the community benefit arm, because, Kaiser Permanente, at least the Kaiser Foundation Hospitals, is the nonprofit side of Kaiser Permanente. A big part of that is indeed, having a community benefit presence and engagement. And so, as you've read in the news, a lot of work has been done in the homeless population in terms of investments in various communities by the organization, but as well as within the Nurse Scholars Academy, we have our community health arm that really is responsible for maintaining and looking for new academic programs, academic partners right now, because we know informatics and critical care nurses and geriatric nurse specialists are huge emerging roles and specialty areas. It's developing those specialties with schools, such as Unitek and others, to be able to serve populations where where really those are the biggest needs. And of course, in a highly digital and technological environment, both as a consumer and as an employee or as a healthcare provider, you have to have those skills in informatics and technology to survive, whether that's engaging patients in telehealth or using a lot of the wearable technologies, digital tools, robotics, AI, you name it, genomics, genetics. And how do you keep up with all of that if you don't have educational programs to offer, much less upskill or raise all ships, for our caregivers, presently employed. And so it's really working. First, it's an assessment of what are the areas of need, and then who's in our backyard that we can partner with
Right.
to, again, innovate, develop new programs, simulation. Oh my goodness, talk about, effects of the pandemic and having to bring anything that was training virtual, and then how do you do skills days and hands-on training? And so exploring, with vendors, how do you use virtual reality, augmented reality, and things like that. So beyond academic partners, it's partnering with our technology vendors and partners as well. So it's huge and an exciting part of this time, Karilyn and team.
You might have heard of embodied labs, which is a immersive technology, and it's very exciting to see these new technologies start to really inform and also impact workforce development. Because not only does it help with training and education, it also helps with shortages, so that you can reprioritize what individuals do in a particular organization, whether it's a hospital setting, whether it's a home setting, whether it's a congregate setting.
That's right.
And, I don't think we mentioned this earlier, but I like to use the term strange bedfellows, because in the past, we sort of walked straight paths. Even when we had partnerships, they were all within the same context. We kind of work with our healthcare providers. But I think, today there's so much more opportunity to work with strange bedfellows, ones that we wouldn't have thought of in the past, that might accelerate something that we're trying to do. So universities might sound not like a strange bedfellow, but working with a technology company in the past would have been quite unusual. Or entrepreneurs who maybe are just trying to germinate something new that you might take a risk on trying out. So I think it's something to keep in mind as you partner, that it doesn't have to be a like organization, and they can be a competitor because you grow. Again, I think your raising all boats or raising all ships comment is really relevant, Rayne. When we agitate each other and we have these discussions and think critically, it helps us all be better providers and be more critical thinkers, I think.
That's right.
Absolutely.
That's right, Jeannee. And when you hear of, companies like Apple with Apple Health, Google with Google Health, Amazon Health, there's got to be a nursing presence, with the products that they're developing. And really, if their goal is to, improve our communities, improve the health of our communities with these products, not having nurses, in their boards, in their development system. And so just imagine those new roles that are emerging for nurses outside of healthcare as well. So it's great to see chief nurses, chief nurse informatics officers, chief nurses in those technology companies, to your point, Jeannnie. And of course, who knew Dyson would be creating ventilators? Who knew Tesla would be creating ventilators for us? I mean, just again, impacts of the pandemic in terms of how our industries are really need to be united, to your point, in those cases. So thank you.
Yes. Well, we don't have any further questions in our chat, but I do want to thank both of you for providing such great examples of how partnerships can enrich and develop your workforce. And we really appreciate your time today.
Well, thank you so much, Karilyn. This was great. And it's been such a great conference. So thank you to Unitek and everybody who helped put all this together. It's really been terrific. Thank you.
Thank you.
Thank you so much, Karilyn. And we look forward to working with you more. As you can see, you're embedded in our organization and our culture, and and with Caring Science, behind us, we're going to do a lot of great things together, and really look forward to working with you soon.
Yes, we look forward to that. Thank you very much.
Thank you.
Thank you.